안녕하십니까. 온라인 서절의 김경원입니다.
Greetings, I'm Dr. Kim Kyung-won of Online Surgery. I'm honored to share with you my surgical clip today. Let's look at today's case. This is 67 years old male patient. In the upper right area, number 16 and 17 are missing. In number 16, it's practically healed ridge. According to the patient, about 10 years ago, the tooth was extracted, and in number 17, about 3 months ago, because of severe mobility, it was extracted at a private clinic due to severe periodontitis. If you look at the patient's medical history, the patient had hypertension, which was under control. The patient was taking anti-thrombotic agent. If you look at the patient's history, the patient received coronary stent surgery in 2011 and 2013. It's been about 10 years since the patient received the final procedure. Because intake of anti-thrombotic agent was not a major problem, we had the patient to suspend one drug and continue to take aspirin. The plan was to use OneGuide to place implants in number 16 and 17. You'll see it on CT, but there was a significant alveolar bone destruction in number 17. The patient said there was severe mobility in that area before extraction. We anticipated GBR to be necessary. In this site, I'm going to show you how the flap was open, elevated, and GBR was done along with implant placement. In number 16, you can see that it has been extracted 10 years ago, so this is fully healed ridge. There's no major problem. In number 17, on CT, defect was observed. On the mesial side, buccal wall is still there. I plan to remove granulation tissue if there was before performing GBR. I talked with the OneGuide team. So in number 16, residual alveolar bone height was about 8.5 millimeters. Without using one cast, OneGuide kit was used to drill 8.5 millimeters. By doing this, you'll be able to engage the cortical bone on the sinus floor and place the implant in a more stable manner. The alveolar bone height is slightly more in number 17. By drilling up to 10 millimeters, it will be in contact with the cortical bone of the sinus floor. As for this site, extraction was done 3 months ago and there was defect. In that case, a GBR would be a good idea. That was the plan. If you look at the panoramic image, in number 16, 8.5 millimeter, and in number 17, 10 millimeter implants were placed. OneGuide template was adapted, and on the palatal side, incision was made. Flap elevation was performed. In number 17, granulation tissue were removed thoroughly. Implant placements were done, and AOS was used. Bovine bone graft was done, and on top, collagen membrane was added, and suture was done. This is immediate post-op image, and in number 17, in the distal area, you could see that bone graft had been done sufficiently, and there's increased radial opacity. In number 16, implant was placed. This is CT image, and this is immediate post-op 17. You could see that the implant is engaging the sinus floor just as we had planned, and in the distal area, bone graft was done. This is panoramic image 1.5 months post-op. This was at post-op 4 months. No major problems were observed in number 16. In number 17, the placement position looks okay, and a bone is stabilizing. Sectioning was done on the distal side of number 17, and you could see that the bone graft material is still there and radial opacity still maintains. Practically speaking, the buccal wall is being maintained and it is healing nicely. Second surgery was performed 4.5 months later in number 16. The ISQ was 79/81. In number 17, it was 72 and 74. The conditions have improved compared to immediate post-op. On the panoramic image, distal to number 17 implant, the bone is stabilizing. As shown, ER-type prostheses were delivered.
지금 보시면 수술하고 약 6개월 후에 파노라마 영상이 되겠습니다.
This is panoramic image post-op 6 months. Distal to number 17, GBR was done and it was nicely maintained. Let's take a look at the surgical clip. OneGuide template was adapted and mirror was used to check whether it fit properly. Because GBR was planned, slightly palatal incision was made. From distal to mesial side, blade number 15 was used. Flap elevation was done. Number 17, extraction was done 3 months ago. Granulation tissue existed, so it was thoroughly removed. Because GBR was planned in number 17, in order to make sure that there's no granulation tissue is left, curettage was done before placing the implant. It's not really visible here, but in number 17, granulation tissue existed. It was thoroughly removed. In this state, with the flap reflected, OneGuide template was adapted. Again, a mirror was used to check the fit. The flap was not fully reflected, but you can see that the flap would not get in the way of implant placement. Initial gold rim wide type was used in number 16. Initial drilling was performed. Initial drill in number 16. 3.5 by 8.5 OneGuide drill was used. I actually anticipated slight penetration of sinus floor. 3.5 by 8.5 drilling was done. This was followed by 5.0 by 8.5 drilling. This was fully healed ridge, so full drilling up to 5.0 was done. I did not use depth gauge, but I anticipated the sinus floor to be slightly penetrated. KS3BA surface 5.0 by 8.5 mm implant was placed 80% using engine. Primary stability seemed to be good. Hand wrench was used. Implant driver was used to get final position. Primary stability was over 30 Newton centimeters. Hex positioning was checked. In number 17, wide type initial drilling was done. 3.5 by 10 mm OneGuide drill was used. I thought that it might penetrate the sinus floor slightly. Drilling was done. On the distal area, because there was no bone, I considered using 4.5 for final drill, but because I was going to penetrate the sinus floor, I decided to use a 5.0 by 10 mm OneGuide drill for final drilling. KS3BA surface 5.0 by 10 mm implant was placed. If I had used a 4.5, but if the alveolar bone on top was not in condition, the implant would not be placed properly. Therefore, I drilled up to 5.0 fully. 5.0 by 10 mm implant was placed as shown. Primary stability looked okay. Implant driver hand wrench was used for final position. Primary stability was comparatively favorable. It was over 30 Newton centimeters. Hex positioning was checked using the mirror.
스마트팩을 이용해서
Smart peg was used to measure ISQ value.
16번 부위는 78, 79.
In number 16, it was 78, 79.
부위는 디스탈 쪽에 아무래도 치조골이 없기 때문에
It was favorable.
69, 69.
In number 17, in the distal area, because there was no alveolar bone, it was 69, 69. It's not very bad. It's comparatively favorable. In order to do GBR, cover screw was connected.
16번 부위에 커버 스크루 잠그고
Cover screws were connected.
마찬가지로 17번
Cover screw was connected in number 16 first, and in the same way, it was done in number 17 as well.
부위에 디스탈 쪽에 봉긋 디펙트가 좀 보이고요. 그 부분에 대해서
If you look at the mirror, distal to number 17, there's a bone defect.
같이
Oss particle bone, which is a bovine bone from Osstem, was used as shown. Sufficiently, GBR was done.
있는 부분을 확실하게
Distal to number 17, implant was slightly exposed, and Oss was used sufficiently for bone grafting. On top, collagen membrane and OssGuide was used to cover that area.
남아 있는 부위 가지고 17번 거 뒤쪽
Number 17
두장 정도
and distal to number 17, 2 layers were used.
보시면
You can see that the bone grafted area was covered by OssGuide and suture was done.
그다음에 봉합을 시행하도록 하겠습니다. 먼저 앞쪽에
Flap was positioned
주고
and
앞에 있는
anchor suture was done using the mesial tooth. GBR was done, but not significant amount was augmented. Even without periosteal releasing incision, suture was deemed possible. Suture was done. Figure of 8 suture was used.
봉합을 시행하도록 하겠습니다. 저희들이 이제 원가이드를 사용하는
When you use a OneGuide, many people just think of flapless surgery.
상악골에
However, as shown in the maxilla, especially in the posterior area, if there is bone defect around the implant top area, GBR can be planned. The OneGuide template was adapted before surgery and an incision was made on the palatal side. To elevate the flap without tissue punch, OneGuide was used and implant was placed.
경우
In number 17, on top there was no alveolar bone.
만약에 이제 사이너스의
If you are to penetrate the sinus floor, you need to drill up to 5.0, and once the implant engages that area, you could gain sufficient stability. Thank you for watching.